Last, if you remember, the remedy we spoke was cellular. Officially, okay, the remedy we spoke was cellular. Okay. So cellulonium, any quick questions, any quick clarifications you have in cellulonium? If you have anything to ask in cellulonium, we will look at the problem area of yours. It was a small remedy, if you remember, and we mainly focused on what was the highlighting point in cellulonium? It's a liver remedy. It's a liver remedy, it's a right-sided remedy. And other than liver, you also saw that it has an action on the lungs, pneumonia, vagus nerve, and you also saw facial paralysis, neuralgia, okay. And you also had a lot of GI affections related to appetite, related to lower bowel, okay. And it belonged to which family? Papaceae, okay. And I told you there are 3 remedies which are very prominent and very important when you talk of this particular family. Opium, sanguinaria, canadensis, and of course you have children, 3 major remedies. Fine. See, today I just start with a very simple case. You belong to CBDC, and the learning in CBDC is going to be little different and little unique. NCH, National Council of Homeopathy, they have taken pains in creating a new curriculum which is mainly student-centric. Okay. So a lot of new innovative ideas they have tried to incorporate. One simple way or one simple example is learning a remedy through a case, and this is what they call it as case-based learning. So in today's class, we will make a small attempt in understanding the remedy that I am going to teach through a small case. Okay, I will be giving you some 2 or 3 cases, but I will start with a small case, and then we will try to understand what was the remedy that we arrived at, why did we arrive at this particular remedy, and after giving this remedy, what exactly was the change that was observed. Okay. So your attention, you will be focusing on the PPT and you will be giving your inputs. Now what is it that I have just written here is, see, this is a very fresh case. Last week, a homeopathic couple, they had called that, telling that their child, baby girl, 2.5 to 3 years old baby girl, she has been having fever. Small case, she has been having fever. Fever for past 3 days. They have tried some remedies. Unfortunately, it did not work. That's when they called me, sir, she's been having high fever. What do we do? How do we go about? What remedy? Etc. etc. As a second year student, and it is too early, but knowing the enthusiasm that you guys have, I am sure you will come out with some solution to this particular situation. As a second year student, again I repeat this, as a second year student, what should be the probable questions you will be asking? Okay, answer. Fine. Duration, one of your friends says duration, onset, type of fever. When is it more? Okay, she wants to know when is it more. What caused fever? Okay, very good. Aphorism number 5. So, Dr. Ailments talks of something called as exciting causes. And this is again a CBDC thing where we are trying to integrate a lot of subjects. I spoke of vertical, horizontal and spiral. Okay. So, aphorism number 5, what type of case is this? This is a simple case with a duration of 3 days. So, what is it? Is it acute or chronic? Very good. All of you agree it is an acute case? Fine. So, when you are dealing with an acute case, you have a different way of looking at it. When you are dealing with a chronic case, Dr. Honeyman gives you different guidelines. This is an acute case. This is an acute case. So what you need to remember here is, acute case when you are dealing with, first thing we need to inquire is, what was the cause? Ailments from. And then, what else? You are talking about duration. Duration is very clear there. 3 days. Okay, what else? When is the fever more? Absolutely fine. Agreed. Good. Appreciate. Any other symptom other than fever? Very good. I told you second yes, you will not disappoint me. Thank you for not disappointing me. Good. You have got a lot of clarity. What exactly one needs to ask in an acute case. Fine. Any other symptoms? Okay. Good. So what we got in this case, I'll just brief you the case. I have a small video also, though the parents are permitted that it can be shared for educational purpose. Today, right now I don't have it, but what was observed in the video was, the child was sleeping. The child was sleeping beyond, meaning deep asleep. In spite of parents waking her up, she is not waking, she is deep asleep. Okay, that was one very important thing we saw. And aphorism number 5, going with our master, Dr. Honeyman, he says you should look into an exciting cause. So what was that exciting cause? What happened? How did the fever start? Sir, 3 days back she had been to a new place, a new person, and she was afraid seeing that, being into that new environment. So what is that ailment? Ailment from fright. Ailment from fright. And what you also see, with fever, the girl is very sleepy. The girl is very sleepy. Okay? And not past motions for last 3 days, appetite down, all these things. So around 12 or 1, in the afternoon, we prescribed a medicine, and by evening 5, the mother shares telling, child is much better. Her appetite has improved. What should improve first is also very important. What should improve first? Very good, beautiful. Generals. For a second year students, hats off. Generals, good. Now what is that general? That sleep, what was too much, that became normal, appetite improved, and night 11, she again sent me a small video. I had requested for a small video where the child is busy playing with her toys. She passed motions, she had her food, and she was absolutely fine. Single dose of remedy, and the remedy that was prescribed is what I am going to discuss today. Okay, I know what I will be discussing. You all know what I will be discussing because I had revealed in the last class. This is the remedy I am going to discuss. But please remember the case. Please understand the sequence, and we will slowly relate this to the case, or slowly relate this case to the remedy that I am going to discuss. See, beautiful take-home points. What were the take-home points in this case, in this small case that we saw? What were the take-home points for a beginner? Homeopathy works? Yes? You students need to have that confidence, because your entire life depends on this beautiful science. Okay? Meaning how confident you are, how convinced you are about this science, that will take you to greater heights. So first thing what we understood was, no paracetamol given, okay, with due respect. So what we saw here is homeopathy works, and how effectively homeopathy works is also very important. How effectively it worked? Was it slow? Generally we all say no, homeopathy is slow. Homeopathy is slow. Fine? You're getting my point? So what was the key take-home points is, homeopathy, if you give it correctly, as per the principles laid by our master Dr. Honeyman, similia similibus curantur, when you match the remedy perfectly, it does wonders. And this was one simple case which I saw recently in my clinic, and that's what I wanted to share. Generals improved, activity improved. The child was deep asleep, who had to be woken up, was drowsy, was sleepy, is playing. And after that, no further episodes of fever, and she is absolutely fine. You are getting it? Done? Okay. So the remedy what was given, before that I just wanted your inputs. You have already given your inputs in a very systematic way. Appreciate it. Now this was the remedy that was prescribed. Opium. A remedy which belongs to Papaverinaceae family, and that is opium. See, opium is something that you already know. You are in second year. How do you know about OPD? How do you know about opium? I have something else. How do you know about opium? Very good. Pharmacy. Sharnappa sir. Fine? Pharmacy. Very good. So what is very important for you here is, you should also be very lucky to have Sharnappa sir. Fine? Hats off to a great teacher. You are lucky because pharmacy is made interesting. People love pharmacy. Generally it's a very dry subject. Right? So a dry subject with this teaching technique is made it very interesting. Okay. So this slide is dedicated to Sharma. Okay. So what is very important is, we will quickly recall the alkaloids of opium from the knowledge of pharmacy. From the knowledge of pharmacy, we will quickly recall the alkaloids. So what are the alkaloids of opium? What is it? Yes, very good, right, correct. You need to be a little more louder. What is it? What are the alkaloids? See, it's got plenty of alkaloids. Okay, for example, I just got you few very important. Morphine, which you know, which is used by our allopathic friends. Morphine, heroin, narcotine, apomorphine, tepaverine, and there are plenty, many more. I have just given you a small introduction. And as per CBDC, these are all nice to know. This information is nice to know. And one more nice to know area here is, to which natural order opium belongs to. Opium belongs to Papaverinaceae. You saw that? And common name is opium, monsoft, and preparation, if you just remember here, this exudate, this gummy thing is what? The tincture of the gummy extruded from the unripe capsule is what we use in homeopathic preparation. These are all nice to know information about opium. Now we look at that information which is must know. Okay. Now before I take you there, the must know area, I have kept it very simple. We have only 3 small objectives. It's a very important remedy. It's a polygraph remedy. You will understand that. I don't want to rush through. We have been given 3 hours to teach opium. So we will slowly take understand because it's very, very important. In today's class, we are going to focus, as I just said, we are going to focus on 3 areas. First area is spearhead and pathogenesis. And second area that we are looking at is ailments. What are the causative factors is what we are going to look at. And the third very important, or the last objective for today is we are looking at the constitution. We are looking at the constitution. How do they look? Physically, how do they look? So that is what we call it as the physical constitution of opium. Okay? Hope the objectives are clear. Okay? So 3 very important things: sphere of action, pathogenesis, ailments, and constitution. And here, when I will be dealing with the ailment section, I will be sharing 2 more cases of opium. Very, very interesting cases. So we will come back to the first very important objective that we have set for today. And what you see here is, it is a deep acting remedy. Now what do you understand by a deep acting polygraph remedy? It acts on multiple organs, various parts, and the effect lasts for a longer duration. Okay? So we will be starting with the first sphere of action. Opium mainly acts on the brain. Mainly acts on the brain. Acting on brain, it can cause 2 very important things. One is intense congestion, and the second very important thing. As you grow, your journey in homeopathy, you will be seeing many senior homeopaths using opium for coma. Using opium for coma. and many cases, many coma cases have successfully come out after opium. So it's a very important remedy. Fine. So coma, especially in drunkards, coma especially in old people, only remedy in our materia medica is opium. Okay. Must be, as we unfold opium, I will be giving you more indications of coma and opium in the later classes. But in today's class, we will be focusing on its sphere of action on head, sphere of action on brain, and very important is its action on the spinal cord. Okay, spinal cord. Okay. So acting on spinal cord, from your knowledge of physiology, anatomy, from here you see a lot of nerves emerging, nerves coming out from the spinal cord. So what you see here is, it acts on the nerves and it will cause complete anesthesia. What is it? It will cause complete anesthesia. From the allopathic point of view, if you just go back, morphine. What is morphine used for? Fine. Like people, especially cancer patients, terminally ill patients, when they are suffering with too much of pain, morphine injections are given. Correct? Okay. So this is because it has got an effect to decrease the nervous supply, denumb. I will come to it a little later. It will denumb. Fine. So it was complete anesthesia, and like chelidonium, like antimonium tartarica, like naxomica, okay, it has an affinity for the vagus nerve. Anticat, naxomica, chelidonium, and of course we are also talking of opium. It acts on the vagus nerve, especially it affects the respiratory center. It affects the respiratory center, and it again causes paralysis of the respiratory center. Clear? It is causing paralysis of the respiratory center. See, these things are very important, because tomorrow when I talk to you about characteristic symptoms, when I talk to you about particular symptoms, this information will help us connect. Why in opium there is no pain? Now you can go back, because opium has an action on the spinal cord and it is affecting the nerves and it is causing anesthesia. So there is no sensation, there is no pain. Painlessness is something which is very, very prominent in opium. I will come to it. But when I talk to you about painlessness, you should immediately come here under this heading sphere of action, and you should start connecting. And homeopathy is a beautiful subject, beautiful science, and materia is a beautiful subject. And I have got great remedies. Fine. And if you look into the literature, lot of stalwarts, they have contributed so much. And it is our incapacity that we are not able to understand and apply materia medica or homeopathy properly. If applied properly, it can do wonders. That's why we teachers are taking pain to make you understand, so that you understand this beautiful science and you apply it in the suffering society. Okay. So paralysis of the respiratory center. See, this I have taken from Dr. Phatak, a very important author, Indian author. He has contributed a lot to materia medica, and I have straight copied this from his materia medica, and he says, please read this, very important, it affects the nerves. Fine. Mind and senses producing insensibility of nerves. You are getting this? Can you connect this now? Painlessness. Fine. Depression, drowsy stupor state, torpidity and general sluggishness of function and lack of vital reaction, a kind of negative state. What is it that we saw in our case in this paragraph? You saw drowsiness. You saw that particular child, because of fever, she is going in a stupor state. She is in a drowsy state. She is in a sleepy state. Okay? Now this is what Dr. Fartak talks of, about opium. So what is our first objective? We are looking at sphere of action, and this slide is very important because we are dedicating this slide for opium, and we are looking at the action of opium on nerves, CNS, and of course the vagus nerve. Vagus nerve, spinal cord, brain. Three important areas. Moving forward, we'll also see that opium has a very important action on the eye. See, opium is a great paralyzer. Can you name few more paralyzers? Very good. Gelsemium. Beautiful. Naxwamika. Caustic. No problem. Causticum, Naxwamika, Gelsemium, Hypericum. Okay, we'll come to it. So what I was trying to tell you is, this can cause ocular muscle paralysis. The ocular muscles, they can go into paralysis. Thanks to Google, at least you get to see an image of ocular paralysis, oculomotor paralysis. One. Second very important thing, can you appreciate, this is the normal eye, this is the eye you get to see in opium. What is it that you appreciate here? This is the normal pupil, and this is constricted pupil. Opium acts on the eye and it causes constriction of the pupil. Hope I am clear. Other than CNS, it is acting on the eye, and moving forward, we also see that this remedy has a beautiful action on the heart. Again, what are the other remedies from your first year syllabus? Aconite? Only aconite? Okay, belladonna? Barretta, very good, barretta. Yes, good. क्या होता है barretta में? What will happen in barretta? What will happen in, very good, who was that? Beautiful, louder. Good, keep it up. Atherosclerosis. Good, barretta. So what will happen? What is the indirect result in barretta? There is, I showed you in Aurum. What is happening? The interior part of the arteries, blood vessels are deposited with fatty thing. We spoke that as plaque, atherosclerosis. So what will be the effect of this on the heart? Heart has to pump with more force. So ultimately hypertension. Barretta can be one beautiful remedy for hypertension. Okay? More prominent in barretta mure. As an assignment, you can go back and look. What is that speciality you have in barretta mure? I'm just showing my video. BK sir, show this when he was talking about barretta mure. Okay? Done? Okay, we'll get back to this remedy. Opium has action on heart. Aconite, what was aconite's action on heart? It was beautiful, good. Yeah, your friend is using the word increase. It is increasing the action. So what you see in aconite patient is, you see pulse is very high, pulse is very rapid. Right. Exactly opposite thing you see in opium. Why? Because there is slowness, sluggishness, depression. Beautiful, good. I am happy with the words. Pulsation lessened from vagus paralysis. The vagus nerve that goes into a paralytic state, and heart action is getting affected, and you see weakened or lessened pulse. Bradycardia. Okay. One more remedy from your second year syllabus for bradycardia. Calcarea. Okay, calcarea. Is baptisia done? Yes or no? Yes. So what is that bradycardia you have in baptisia? So that is what we call it as relative bradycardia. What is it? Relative bradycardia. Typhoid. Fever is high. What is the relationship between temperature and pulse? 1 degree temperature, then pulse will increase. Okay. In bacteria, though the temperature is high, pulse will be low. And that is the technical term we use in our medical field. We call it as relative bradycardia. So bacteria has relative bradycardia, and this remedy has less pulse. Okay. GI. You are getting a clarity. What is that clarity you are getting? This is a remedy which is having action on various systems. We started with nervous system, a very important system, and then we spoke of eye, we spoke of cardiac system, and now we are looking at GI system. GI. So the general action of opium on the GI system is it causes dryness. It causes dryness. One more remedy? Bryonia. One more remedy because you are a second year student. Alumina. Alumina. I don't know if it is done, but please do remember. Done? Very good. I appreciate the sincerity. Many times you know what students does. What do they do? If a remedy is told, they, all of them in one word they say, sir, no, it is not done. But I appreciate at least you are accepting the fact it is done, and we will be learning. This is what I am adding in the end. Okay, okay. So J. Now you see the mucous membrane, you see dryness, bryonia, alumina, 2 more remedies. Not only dryness, you can also see paralysis, paresthesia, right? So you just see here that acting on the GI, acting on the stomach, opium can give rise to nausea, opium can give rise to vomiting, and acting on the lower bowel. So remedies acting on the lower bowel: asculus, aloes, naxomica, bryonia, and of course you also have opium. So I said dryness, that was one part. Which is the remedy in which there is constipation because of dryness? Constipation because of dryness. Bryonia. Dryonia. What is it? Our teacher, one sir, we still remember he telling for bryonia, used to tell dryonia, meaning there is so much of dryness. Almost all mucous membrane go dry. Right? Exact opposite action you have on the serous membrane. Serous membrane in bryonia you see effusion, mucous membrane you see dryness. Okay? So here there is bad constipation. This I will be telling again under characteristic symptoms. Now why constipation in opium? Because of paresthesia. Paresthesia. Constipation you also have in naxomica as a second year student. Why? What is the speciality of constipation in naxomica? Very good. Was that ineffectual urging? Why there is ineffectual urging? Because there is peristaltic movement which is not regular. There is irregular peristaltic movement. There is no slowness of peristaltic movement like your alumina. There is irregular peristaltic movement, and that's why in naxomica you have ineffectual urging for stools. They are very important. Tomorrow one patient comes to your clinic and says, sir, last 3 days I have not passed motion. And what is the next question you ask? Boss, do you feel like passing motion? No sir, I don't feel like passing. Then you do naxomica. Is it correct or wrong? Why wrong? Because your friend gave me another remedy. But my question here is, why not naxomica? Because if you have read Bolik's Materia Medica, when you read naxomica under Bolik's, Dr. Bolik says very clearly, no urge is contraindicatory of naxomica. Last 3 days I have not passed motions and I don't feel the urge, the remedy will be bryonia. The remedy will be bryonia. Last 3 days I have not passed motion and I don't have any complaints. I am okay, I am eating well. That is calculated. You are getting the difference. Good, I am happy. You told calculated. Keep it up. But you should know the difference. Absolutely not. Bryonia, absolutely not, and I am comfortable. This calcarea, absolutely not, cannot be metformin. This is the clarity you people need to have. So we will go ahead and we look at the action of opium on the mucous membrane. It causes dryness. You saw that the secretions are decreased and it causes dryness. In brackets, please add bryonia and please add alumina. It will be useful for you. Kidneys, any organ you mention, you see opium acting. That's why we say it is a polycrest and that's why we say it is a deep acting remedy. Okay? So on kidneys, any remedies acting on kidneys? Apocenum, very good. What is special in apocenum? What is special in apocenum? When I say that, you should say dropsy with thirst. Just saying dropsy and keeping quiet is not apocenum. If it has to be apocenum, dropsy with thirst. Why am I insisting on thirst part? Because you also have a remedy in your material medica, very good, which has dropsy and with small thirst. And that is clear? I hope you are understanding the seriousness of the remedies. Tomorrow somebody has dropsy and he has thirst. You give Epis and you blame homeopathy. Sir, homeopathy is bogus. It does not work. You are bogus. Don't blame this science. Don't blame the system, because what we are today, at least what I am today, is because of this. And somebody telling something, we cannot take it. If you are not getting results, then you are not applying the science properly. Fine? I was telling you, who was it, Dr. Stuart Close or Dr. Richard Roberts? What did he tell? It is the homeopath who fails. It is not homeopathy. Who was that, Stuart Close or Roberts? I don't know, I know what they do. Please have a look. So, here, apocynon, Apis mellifica are few remedies you should remember. Here, it causes decreased secretion. So, apply your physiology here. When the secretions are decreased, what is it meaning? What is it? What do you understand by this? Urine secretion is decreasing means urine is getting collected, meaning it is getting solidified. So ultimately what you see is decreased secretion, solids increase, and there will be a tendency for calculi in opium, urinary calculi, renal stones. Better remedies? Berberis vulgaris. Better remedies lycopodium. It's already done in your first year. Lycopodium is right-sided, berberis is left-sided. Simple. Okay, you also have opium. We'll explore in later classes what is that calculi, which side, etc. etc. Deep acting remedy, you see this acting on male genitalia. Two things it can do here related to the sexual urge. One image I have shown and I will be showing you the second image. Fine? So in the first image what you see is there is excess sexual desire and over a period of time there is impotency. Increased sexual desire followed by impotency. Another thing that you see here in the female is it will cause excess menses or it can cause very scanty menses. Okay? Excess menses or scanty menses under female. Any quick questions in the first objective? What is the first objective? Sphere of action. Boys behind? Any questions? You are clear? Fine? Okay. So, the second very important objective that we will be looking at today is the ailments of opium. What are the causative factors of opium? Okay? Okay, we already spoke about the ailment through a case. If you remember, that girl got exposed to some new situation, new people, and then she had fear, and then what you saw was she had fever. So ailments from fright is very, very important. Okay. How is it different from aconite? None of you asked me, sir, why you did not prescribe aconite to the child? So aconite will not be sleepy. Beautiful, good. You did not ask the question because you knew the answer. Yeah, that's all. Happy. We knew, sir, that's why we did not ask. Because if it was aconite patient would have been restless. Yes. Aconite patient would have been cranky, irritated. Aconite patient will not go into sleepiness. That's why we did not tell aconite. Good, keep it up. I am very happy and proud. Okay. In opium, see, and one more very important difference between aconite and opium is aconite will be sudden fear. Okay. And in opium, I will be showing you one more slide. The fright remains for a long time. Sir, 10 years back I saw that, and still I have that fear in me. So fear remains for a longer period. The remedy is opium. We will discuss fear, fright, and this is anger. I will come to this, very important. Exposure to sun, ailments from joy, okay? Ailments from exposure to charcoal fumes, ailments in drunkards. I'll skip all this for time being. I'll be sharing 2 cases here. How much time I have? 10 minutes, 20 minutes? Okay, good. 20 minutes is good enough. So what we'll do is 2 small cases, very important, interesting cases. Again a homeopath's son. You are second year student, but I am introducing a topic related to 3rd year, and as an assignment you will be going back and you will be seeing that particular condition. And this condition is, we had a case of a boy, young boy, 8 years, 10 years old boy, who had acute abdomen. He had acute pain abdomen. And they were on a vacation in some place. And that's where the pain started. And mother, she gave some medicines over the counter, and unfortunately it did not work. And then after 3-4 days, they called me also. Once she came to Bangalore, I also prescribed some medicines over phone. Unfortunately, the pains did not improve. So mother got the child directly to the clinic. And when I touched the child, he was in bad pain. And his face was not very, as a doctor practicing for so many years, looking at his face, I was not happy. I felt something wrong. The homeopath mother, she has prescribed medicines, I have given medicines, and in spite of that, he is not better, and face is not very, it was not a very welcoming thing, happy thing. He was into a lot of pain, and he did not allow me even to touch. There was diffuse tenderness. I said, I don't know what you would have done, but you will be growing up with homeopathy and you will understand. I said, boss, something is wrong. And I told her, please immediately get a scan done. So nearby, sonologist, scanning center, she went. They got the scan done, and scan showed intussusception. Please make a note. I will not going into the details of what intussusception is for time being. But what you will have to understand is, the intestines, part of it has overlapped on the other, and that is causing a severe pain. So we understood, seeing the scan, it's a very serious condition. But I still prescribed some medicine, and I told her, please call me in the morning. So around 8:30 I got a call, and she said, sir, sorry sir, he's not at all better. Whole night we were awake, he was also suffering with pain. So at 8:30 in the morning I told, let's not take a chance, please see a pediatric surgeon. Okay, you're getting my point? Because if you read intussusception, you will understand. And I'll give you a small clue, you'll be getting it in your surgery. You'll be getting it in your surgery books. I hope you got a clue now. So ultimately, you would have gone on the surgeon's bed. So the lady she called the nearby pediatric surgeon and appointment, the earliest appointment she could get was at 1 p.m. Please remember, the earliest appointment was at 1 p.m. though it was an emergency. She said, sir, I called, I'm getting appointment at 1. Then again I said, so what do you do now? What do you do now? See the destiny. My teacher Vijaykrishna sir would say everything is mathematics. Why she did not get an appointment at 9? Why she did not get appointment at 10? Because he still wanted to be with us. So what I did, 8:30 again, I sat with the laptop and I reworked. I just again asked her, please narrate everything. Sir, कल रात बताया था मैंने आपको नहीं, कोई बात नहीं, और एक बार बोलना। पर मैं थोड़ा बुद्धू हूँ। मेरा समझ कम है, प्लीज और एक बार बोलेगा. So again she narrated and point wise we understood, we analyzed. Father had scolded, something had happened and the child's reaction was he was very angry. I took it as ailments from suppressed anger. Okay, that's the mistake I did. Don't say, it was a mistake. Fine? And then we took that ailment and we prescribed nothing about it. Then again I asked, what else with anger? Anger, and you also had fear. You wanted to express something, but what darbita, bayanavittu, kopanavittu. So this was the combination. Again I reworked. I took ailments from anger suppressed with fright, and then we took intussusception. We had not passed tools for last 3 days. Constipation because of intussusception. Lot of 3 things were taken, club, and a beautiful remedy came up, and that beautiful remedy is opium. I told the mother, luckily she was homeopath. Madam, आपके पास opium है क्या? है ना sir? बर क्या? So opium 200. One ने पूछा था मैंने, नहीं मिला, opium 200 था. चलो opium 200, 9 o'clock, 10 o'clock, 11 o'clock, 12 o'clock. 4 डोज देना. पीडियाट्रिक सर्जन के पास कब जाएंगे आप? 1 बजे जाएंगे. 4 dose of opium 200 and 12:30 she gets a scan done and scan says there is no intussusception. Right? I am getting goosebumps. See, whatever you are clapping is not for me. It's for Dr. Hanuman and my teacher, of course, Vijaykrishna, from whom you have learned a lot of things. But what I want to try to tell you is, I feel nice because why I am feeling so nice is because we could avoid a young boy going into surgery, and even the pediatric surgeon, luckily great man, we should appreciate him also. He said nothing to worry. The old scan and new scan, there are a lot of changes, lot of difference. It doesn't require any surgical intervention right now. They will observe for 24 more hours and they send them back. Nice gentleman. Fine? Okay. So opium, intussusception, second year student. But I am happy you could understand the gravity of the situation. Then 4 doses of opium 200 and scan shows compared to the old scan, the sonologist. Fine? I mean, they are ethically very nice people. We are very lucky to get such kind of ethically sound people in present generation. So the sonologists also we need to appreciate because they did not do anything. They did not, with the reports they did not do anything. He or she, whoever, with due respect, they compared and they said it's much better. And present scan shows no intussusception. Fine? Okay, and we could prevent a very young boy going into surgery. Thanks to opium. Thanks to homeopathy. You getting my point? So opium has that anger and fright. Very important. Okay. So ailments, see, joy. Many times ailments from joy. How do you take this also is very important. I have a case, I have not given opium there, I have given a different remedy. One girl, her birthday celebration happened after 2 years. Because of COVID, they could not celebrate her birthday. Fine? And the birthday was celebrated in a very grand way. I have all the photos and all. And next day morning she developed fever. And I was asking the parents, I was asking the child, very intelligent girl, I was asking her, Yenama, Yenaito. Fine, father, parents don't know, so nothing happened. She was very happy. What is it? She was very happy. Everybody came, everybody gave gifts. She gave thanksgiving in English. Beautiful speech she gave. Everything father is showing me. Recorded. See sir, so nicely. Very nicely, lavishly they are celebrating the birthday. Everything is nice. Only she lands up with fever. What is this? Anybody scolded? No. What is it that you see this girl is? She was very into. After 2 years my birthday, everybody are coming, She's very happy, excited. So there I had taken this ailments from overjoy. And I did not give her opium, I gave her coffee after. Beautifully she recovered. Fine? So ailments from need not always be negative. Sometimes ailments from can also be positive. Overjoy, bringing in complaints. You can think of opium. Alcohol, many remedies. To name few, ailments from alcohol. Agaritas, Naxman. Don't forget Naxman. Sulfur, sulfuric acid, sepia, cardus, a lot of remedies. Good. Okay. Now very important for you is this. What is this? I am showing you two very important things. Ailments from being blamed, ailments from being ashamed. Okay? Fine? So ailments from insult, ailments from shame. See now you have to realize when you have this kind of an ailment in a remedy, what does this indicate? That these people, they give a lot of value for, they are people with a lot of self-respect. They give a lot of value for what others think about them. So only other remedies mentioned in your repertory is ignitia, is natrum, is stephysagria and aurum. Ailments from shame, only 5 remedies. Ignitia, aurum, natrum, stephysagria and of course this remedy, opium. Okay? Ailments from abuse of drugs. A better remedy? Next one. Very good, next one. Keep it up. Injury. Very good. Don't forget arnica. Arnica, head injury. Right? People going into coma after head injury. Arnica. Initially, arnica. Okay? So, see, this is the statement I was trying to tell you. Can you correlate? See, any complaints which comes in the child because of mother going into a state of fright. You getting my point? So, mother during pregnancy, she had fear, she had fright, and then the newborn, the child is having some issues. Okay. So, in your repertory, complaints in children from fright of mother during pregnancy. See how deep this science is. How deep the homeopath should think. That especially respiratory complaints. Fine? Respiratory complaints. In children, newborn, 15 days, 20 days, they are having pneumonia, bad respiratory affections. Please do ask the mother what fright she had. And many times mothers, they go into shock when you ask this question. मेरा pregnancy आपको कैसा मालूम? Fine? They go into shock. How this doctor is aware that I was in fear or I was going through some frightful situation in my pregnancy. How this man was? Your product is telling us. Your child is telling us. Okay, especially respiratory complaints. Okay, please do ask for fright. Okay. Now, 2 objectives we have completed. Hope it's all clear. The last objective, and then we'll have a quick revision, will be the constitution. Any wild guess why I have taken this image from Google? So, extremes of life. One remedy that should come to your mind? Barretta. He is an expert in Barretta. So whenever I want an answer from Barretta, I will ask him. Because he has never missed Barretta last 2 years. Not that he is Barretta, but he has never missed. the remedy Barretta. So what is important for us here is extremes of life. I did Barretta, if I'm right.
Yes, sir.
Yeah, so I have explained what I mean by extremes of life. Maklo, Mudukuru. Old people. Children, old people. Extremes. So, this I have taken from Alan's keynote. Especially adapted to children and old people, diseases of first and second childhood. This is what Alan says. Barretta carp and millefolium. Persons with light hair, lax muscles, and want of bodily irritability. Old looking children, newborn look like a mummy. Mummy means not his mother. Yeah, I mean, you have seen mummy. What is it? Pyramid, mummified body, you would have seen, no? So they look very dried. I have another image. Children with wrinkled skin looks like a little dried up man. Again, thanks to Google, because of them, at least you are getting an image. And myself, Munir would always tell, anything that you see will have a better impact than what you hear. Fine? So you are seeing. So thanks to them, thanks to those people who have uploaded, so that it is benefiting many of you. Educational purpose. Okay? So tomorrow you get to see a child like this. One remedy that should strike your mind is opium. Opium. Okay? Fine. Now before we close, we'll quickly look at the end of the session, the learner is able to, you are able to recall the sphere of action. What should come to your mind first before you talk of sphere of action? No. What should come to your mind before you talk of sphere of action? That opium is a polycrest remedy. Opium, see, if you have that clarity, then you can decipher from there. Opium is a polycrest remedy, deep acting remedy, affecting various organs. And predominantly it is affecting brain, spinal cord, vagus, nerve, and the second slide you saw heart, before that very good you saw eyes, then you saw kidney, male, female, in between we also had kidney. See, your visual memory should be so sharp. First slide because I showed this, left this, that is how your visual memory should be. And that is why we are taking pain in giving you PPTs. It takes a lot of time to prepare PPT. It's not an easy task. But the idea is, anything visual will have a better impact. And second, what we saw was ailments from, and you saw the ailments were alcohol, sun exposure. I forgot to mention lead, LEAD lead. Bad effects of abuse of lead. Other remedies, platina. Don't forget platina. Don't forget plumber. Abuse of lead. And the other ailments we also spoke of. Fear which remains for a long period. Shame, insult, abuse of drugs, sun, exposure to sun, head injury in general, complaints in children from fighting mother during pregnancy. Very beautiful statement. And if you understand homeopathy properly, this statement can help you treating many respiratory infections in children, if you judiciously use this particular statement. Okay, moving forward, what we also saw was how do they look physically. The physical makeup is what we saw. Generally they are very dry, lean, thin, emaciated, especially children and newborn, who are very weak. And this emaciation comes because opium has an affinity on the nutritive system. Nutrition. It affects the nutrition. Right? Nutrition. Okay. That's why you see that they are emaciated and they are old looking, they are lean, thin, dried up. Opium. Okay. Now, in tomorrow's class, or whenever I am coming next, I will be talking to you about the mind and characteristic symptoms. So please go through, so that our learning will become more easier and more interesting. So this is what I planned. I am also giving you the plan for the future class. So which will be happening next Friday. Okay? Done? So any quick questions? Any clarification in opium? All fine? Chalo, thank you, thanks.